I basically work with these people around, in the one hand, it's about accepting the biological kind of needs and mechanisms. So in the very first step with bulimia, as well as with binge eating, is to introduce regular eating. And that's basically common sense. It's the same way that everybody with or without eating disorder should do. Have you start with the breakfast and so on. So it's a very basic principle. That's the first one we need to address. And then with bulimia and binge eating, the second factor is what can happen is because we kind of deprive ourselves of a food that the body ultimately wants. People with bulimia and binge eating tend to have more genes of, I guess, almost needing more to have the dopamine system satisfied. So have a little bit some of the predisposition that we might see also, or do also see in people who have more predisposed for addiction. So that's another element of what we almost need to accept. So I have that kind of vulnerability. Yeah. So in the second stage, we also need to work with how they can manage cues, how they can manage that kind of wanting response, how they also know that when they have a little bit, it easily breaks through. So that's the kind of learning that needs to happen. And the third aspect is around emotion. Yeah, so we already mentioned earlier comfort eating. So there we help the people to be able to recognize what their feeling is, yeah, to really learn that, not confuse it with a physical need, and then try to translate that into a need, feeling into need, and then what to do about it. So for someone with bulimia, particularly, but also with binge eating, we see often a high rate of impulsivity also. And that means that you can do the most wonderful talking in your talking session and nothing changes in between. So the approach needs to be very behavioral. So on the one hand, help people understand what's going on and not end up with certain ideas what might be causing it. So I make it quite down to earth, so to speak. But at the same time, how to help them in the moment. Then in the actual moment. So that's where little prompts, or you can set your little cell phone for something, or ensure that you have someone you can quickly text, oh, I'm feeling under stress. So that's, to me, I think is something that has been recognized in the field. There's also another more recent evidence-based treatment called integrative cognitive affective therapy. And they started to use little apps also that kind of had these kind of responses in there and so on. So I guess that's where a little bit the field is going. Yeah. So I guess the message, I'm quite aware, there's probably two messages in here where in terms of what to share or say to the more general clinician. I was a little bit aware of time. So one, it's important there are strong metabolic factors involved. Two, particularly with bulimia, also to think about medical risk. It's important to ask for symptom and symptom frequency. And I would still, in a way, I think depending on the interest and background of the counselor or clinician, it'd be important that they at least understand the basic kind of components and drivers. Personally, of course, have quite an investment in high specialist and tertiary care. So I would say ultimately, most people would benefit if they have a more severe presentation from that kind of specialist and care. But there are plenty of individuals also who have, as part of their presentation, some of these kind of eating problems, so to speak. And in that way, knowing the basic message, regular eating, how to help with that, and then to work with the impulsivity, how to work with the aspect of habit, and how to help with emotion recognition and finding more kind of responses that meet the emotion need. I'd say basic principles, but the foundation always needs to be regular eating. Otherwise, you can't do the psychological work.
Well, if you want to know more about the science of psychotherapy, come across to our website, thescienceofpsychotherapy.com, and our podcast of the same name, and learn more about the science of you.